Supramalleolar orthosis or SMOs are widely recommended nowadays. SMO is a very smart device which can control the foot and ankle deformation very well, and most importantly, you can put inside the shoes easily so the patient feel very good. The design of the SMO is very important and there are no limits. You can design in your own way as per the patient requirement. Importantly, you need to stabilize the medial aspect if the foot is mediolaterally collapsed, and then you need to stabilize the calcaneus so the foot has a very stable base. The wings of the SMO, normally they are flexible because we don't want any sort of pressure on the medial and lateral malleolus. But if you want these wings to remain intact, then you can always use a piece of Velcro, elastic or non-elastic, so the wings will remain intact and there will be more stability. But be careful that no excessive pressure is exerted because malleolus are very sensitive. The rest formula is the same: better medial support and better calcaneus support. Sometimes we choose the front part to be opened and sometimes you want to be closed. That also depends upon the patient requirement. If there is spasticity, then certainly we choose a different material and we keep it closed to control the spastic movement. But if there is any flail feet and there are only muscular issues, no spasticity, then you can go for this kind of design which support the foot mediolaterally, and also you can apply an ankle strap which keep the calcaneus at the base so the foot is more stable. For very small children, we use very lightweight material which is well padded inside, very soft. So the whole SMO is basically very soft and flexible, so it does not restrict the foot movement 100%, and that gives a lot of comfort for spastic children. Because when there is spasticity, then we can't use very rigid stuff, otherwise we will have injuries inside the splint. So be careful when you design the SMO, so whether you go for the full length if you need and you want to keep the foot very stiff, otherwise you can always cut the SMO in the forefoot so the patient can have a little movement of the toes. That also improve the proprioception. The material is also available of different types. You can have polyethylene, you can have polypropylene, flexible and little rigid one. So this kind of material we use for spastic one, which is very soft, malleable, and normally they don't cause any sort of pressure source. So the choice of material, the application of straps are very crucial, and then the trim lines are also very important. So then you can end up with a very good designed and multifunctional supramalleolar orthosis. Thank you very much and take care of your patients.